Hello, my name is Ashley. I'm a psychiatric mental health nurse practitioner graduate student. I'm here just to talk to you the latest today, see what's been going on. Mom gave is it okay if I'm able to post this on my school website for this interview today?
Yes.
All right. I'm just gonna ask a few questions, Nalea, see what's been going on. And then Mom, I'll talk to you as well, chime in with you. Nalea, are you okay with your mom staying in here the whole time through the interview? All right. So if you could tell me, how old are you?
16.
You're 16? All right. And I have my laptop here. I'm just going to be jotting down notes, okay? That's all that's here for. You're 16. What grade are you in?
11.
11th grade. How you like school so far?
It's okay.
It's okay? What do you like most about school?
Seeing my friends and doing athletic training.
Okay. Athletic training. What don't you like about school? Learning? Well, is it all of learning or just certain things?
Certain things.
Certain things. What are your grades like right now?
A's and B's.
A's and B's? Well, you're doing pretty good. All A's and B's. It seems like you're learning pretty well. Do you have a lot of friends?
Yes.
How many friends would you say you have?
15.
15 friends?
Mm-hmm.
Any specific like peer groups, anything like that?
No.
Does anybody pick on you?
No.
Do you pick on anybody else?
No.
Okay. What about your teachers or teacher? Do you like your teachers?
Yes.
You do? All right. Anything you don't like about the teachers?
No.
Okay. Cool. So, what's been going on lately? Have you been happy, sad?
Happy.
You've been happy? Have you been sad at all lately?
No.
No. Okay. Have you been mad or angry? No. Do you feel anxious or worried a lot?
Yes.
Yes. So tell me about the anxiousness. When do you feel anxious? Most anxious?
When I get to school.
When you get to school? What about school makes you anxious?
Assignments, tests, and quizzes.
Ooh. Tests and quizzes. I remember those. So when you're not at school, if you can rate your anxiety on a scale, 0 being no anxiety, 10 being the worst ever, what would you rate your anxiety when you're not at school?
1 or 2.
1 or 2. And then when you are at school, if you could rate it on that same scale, 0 no anxiety, 10 the worst ever, what would you rate it?
8 or 9.
8 or 9. Ooh, that's pretty high. Do you have a lot of tests, assignments, and quizzes at school?
Yes.
So how many days out of the week would you say you worry or feel anxious?
5 days out of the week.
5 days out of the week. Is there anything else that could possibly make you feel anxious? Like do you notice when it's certain times besides the assignments, quizzes, or tests?
No.
Just around those times? Okay. Anything that helps bring the anxiety down when you're at school?
Listening to music when I can.
What kind of music do you like?
Hip hop or rap. Or
Hip-hop.
gospel.
Okay. And then, how's your sleep been?
Not that good because I take naps when I get home, so I don't sleep at night.
Okay. How many naps do you usually take by the time you get home?
Around 3-hour nap.
Yeah, about 3 hours.
3-hour naps. And so you said you don't sleep at night?
Sometimes I would. Sometimes I'll be up until like 1 in the morning and then I go to sleep.
So when you do go to sleep at 1 in the morning, do you sleep? Do you stay asleep through the night, or do you have trouble staying asleep?
I'll sleep through the night until my alarm goes off.
No trouble falling asleep either. Now, Mom, I just want to follow back up with you about the anxiety. Would you agree her anxiety, or do you see anything different when it comes to her being worried or anxious, just related to school, or is it at home as well?
You know, it's always at school when it's tests and quizzes.
But you do really good, because do you study?
Sometimes.
Sometimes. How often do you study? You say sometimes. So if you have a test, let's say you have a test maybe next week, how often do you study for that test?
I would study through the weekend, and then like the day before the test, I would study
Okay.
to kind of refresh my mind.
Okay. With your anxiety, I have to go back. I just remembered. Is there anything that you do when you're anxious?
Listen to music.
No, like that shows that you're anxious. Like bite your
Yeah,
nails or
bite my nails and my legs start shaking up and down.
let's see your nails. Oh yeah, you've been biting them.
This one I bit too much because now I can like my skin hurts right about there.
Mm-hmm. I was say chewing nails is not the best for us. No, no, no. Especially when we get down to that part of the nail where it's non-existent anymore. We're reaching the skin, just like you said. So as far as, is there anything else that you like to share with me? No? Okay. Oh, related to your sleep, I almost forgot. Do you ever see things in your room or wake up early or wake up feeling afraid?
Yes.
Which ones are yes to? I asked you too many questions at once. I'm sorry.
Waking up like feeling afraid.
And what makes you feel afraid?
Sometimes I wake up and then I just feel like something's watching me, or my room would be too dark.
Okay. Okay. How's your eating habits?
So
So
I'll eat healthy and then I'll eat junk food.
you eat junk food. How many meals would you say you eat in a day?
5 or 6, I think.
5 or 6 meals?
Mm-hmm.
Okay. And then do you have snacks in the day as well too?
Yes.
How many snacks would you say you have in a day?
3 or 4.
Is that correct, Mom?
Yeah.
I see you over there nodding your head. What is your favorite food?
Seafood boil.
Seafood boil. When was the last time you had a seafood boil?
I think 2 months ago.
2 months ago. Yep. You definitely should go to Southeast Texas. They have really good seafood boils too. And Louisiana, most definitely. So who do you live with?
Both my parents.
Both your parents. And how would you say your relationship with your parents are?
Good.
They're good. Okay. Favorite parent?
Mom.
Mom? Is that true, Mom?
Yes, definitely.
Is there anything else that you would like to share with me?
No.
Nope. Okay. Now we're gonna get a little bit more into the history of like family, maybe your mom, dad as well too. When you were growing up, Mom, did she have any learning or attention problems?
No, not at all. No.
Okay. And then did she ever get anxious when you left for long periods of time? Like let's say you take her to daycare and you notice that she cried even when you left, or she immediately run back to you, like, or did you notice any? She's nodding her head yes.
Well,
So
yes, because she started school at 18 months, so
okay.
To me, that was normal, but when she got used to it, it was now I don't want to leave.
Okay, gotcha. Is that true? um, any changes in her mood? Like, have you noticed that she's been really sad for long periods of time, or just upset or anything like that?
No, just anxious when it comes to the quizzes and tests. She does a lot in school, so
Okay.
besides besides that, no.
Okay. Any behavior problems like getting into trouble at school, not listening,
No, no, none of that.
anything like that, Nalia? No. Um, and then any history of traumatic events? Anything traumatic ever happened?
The only thing traumatic when she lost her sister in 2011.
I'm sorry about that. And so now we're gonna just see, like, have you ever had have you ever spoken with a psychiatrist or anything with the mind as far as a therapist, anything like that?
No.
Anything like that for her mom?
No.
Okay. Any inpatient hospitalization? Has she ever had to go to the hospital for her mood or behaviors or anything like that?
No.
Okay. And then has she been on any medications to help with mood, sadness, anger, anxiety?
No.
Okay. And then any genetic testing? Has she ever had any genetic testing before?
No.
No. Okay. And then Nalea, this question is a pretty serious question. I'm gonna ask you, have you ever had thoughts of suicide? Have you ever had a suicide attempt? No. Okay. Any plans, suicide plans, nothing like that? Okay. Okay. Any medical history, like anything like high blood pressure, diabetes?
When I was younger, I had to be at the hospital because my airway was so narrow
Mm-hmm.
that had to be put on a breathing machine for a little bit.
How old were you?
She was probably maybe 7 or 8 months.
Oh, you were a baby. But no asthma, anything like that? Any recent illnesses like a cold, pneumonia?
No.
Any, and then you let me know you had a hospitalization when you were 7, 8 months. Anything since then?
No.
Okay. Any histories of head injuries or loss of consciousness? Like, have you ever passed out before or blacked out?
No.
Okay. Any seizures? History of seizures?
No.
And then, have you ever had any surgeries?
No.
Okay. And then, any heart problems like swelling in your legs, ankles, anything like that?
No.
Okay. Do you take any prescribed medications right now? Like if a doctor were to give you a medication and say, take this medication every day or every other day? No. Okay. And then do you take any medications that you buy from the store, like vitamins, supplements?
Yes.
What medications do you take over the counter?
Motrons.
Motrin and what else? Just Motrin?
Vitamins.
Vitamins.
Which vitamins do you take?
They're the gummy Nature Zone.
Good. And then, do you have any medication allergies?
No.
Nope.
No.
All right. So Mom, this part is for you. Any history of medical problems for you?
Yes. Heart disease, hypertension, and fibroids.
And then any do you take any medications right now for any of those?
Yes. For the hypertension and heart disease, lisinopril, HCTZ.
Okay.
Fibroids are just over-the-counter medication, Motrin.
And then any gestational complications?
No.
Oh, Nalea, how tall are you?
Last time my doctor said I was 5'6.5", I think.
And then about how much would you say you weigh?
She said I weighed 132.
132. Okay. Um, any Mom, any with your delivery history, any full term gestations?
No.
And then any spontaneous deliveries?
Yes, just one in 2011.
All right. And then did Nalea meet all her developmental milestones?
Yes.
And as far as her education goes, you said she started school. They started school at 18 months.
Mm-hmm.
Okay. What was? Do you remember her level of activity when she was in preschool, daycare, things like that? Was she an active baby and social? Any
Yes.
language or learning barriers there?
No.
Okay. And you're 16 in the 11th grade.
Yes.
So that means you're graduating early, right?
Yes.
All right. So what do you want to do after you graduate?
Do 2 years at ACC and then either transfer to Lamar University or UT, but I think I'm gonna go to Lamar University.
What's your major? What's your major going to be?
I want to be a pediatric nurse. So
All
nursing.
right. You want to deal with the babies. So exciting. How are your report cards been?
They've been good.
Still mostly A's and B's?
Mm-hmm.
All right. And then with the standardized testing scores, how have you been doing with that?
Good. I've passed all of them since I've been taking them.
Good. Good. And then are you attending school on the regular?
Yes.
Good. Any major medical problems in the family?
Just heart disease.
And any history of genetic disorders?
No.
Thyroid disorders?
No.
You mentioned heart problems already. Seizures?
No.
Or headaches?
No.
Okay. Any substance use?
No.
Okay. Has anyone in the family ever completed or attempted suicide?
Yes.
Which family member was that?
Her brother.
And then any medication treatment and response?
No medication. He was supposed to take medication, but instead of taking medication, he did counseling.
Okay.
Therapy and counseling.
And so, Nalea, where you know where you live?
Yes.
You like the neighborhood?
Yes.
What type of home do you live in? How would you describe it?
Peaceful and chill.
And how many people live in the home?
In my house,
Mm-hmm.
3.
Are you in a 1-story or a 2-story?
2-story.
Okay. Anybody else that helps take care of you?
My grandma.
Your grandma?
My mom's mom.
Oh, mom's mom. Okay. And how's that relationship with her?
Good.
Good. Do you have any interests or hobbies that you like to do? Skills?
Singing, cooking, and athletic training. Oh, and nursing.
All right. You sing. All right. And Mom, has there been any abuse in the home?
No.
Nalea, has there been any abuse in the home?
No.
Okay. And are there firearms in the home?
Yes.
Nalea, do you know where they're at?
Yes.
You don't touch them though, right?
No.
And then any signs of like physical aggression? Do you ever get really upset and want to just go out and hit somebody or hit something? No. Okay. Any specific questions, concerns for me? Mom?
No.
Okay. Thank you guys so much for your time.
Thank you.